Well, as always on a Sunday when possible, or maybe Mondays, but today is Sunday, we've got David Ashford, the Minister for Health and Social Care, looking at some of the questions that you have sent in. And obviously I've condensed a lot of these, Mr. Ashford, because it is the same thing in different formats. But even with this condensing, I'm sure you'll find that we kind of dealt with it already. But as you know, people ask the questions, I do try and get answers from you. The first one, which really is just going back on what we were talking about 111 levels, the Manning levels. You were going to try and find out for us how it's going. I've heard it's increased anyway now. But, so let's try this one, really, to move this question on. Are you happy with the Manning levels now on 111?
Yeah, I am content with the Manning levels. I think the Manning levels within it, I still don't have those figures from 111. I have asked for them because 111 sits in the Cabinet Office, not DHSC. And as soon as I've got them, Paul, as I promised, I will share them. But in relation to the Manning levels, I've had anecdotal evidence from people who've been trying to contact 111 that things have massively improved. Again, I'd like to thank people for their patience. Like I said at one of the briefings, it was a perfect storm, really. We had a huge batch of vaccination letters going out. We obviously had a huge amount of contact tracing where 111 needed to contact people and tell them to immediately isolate. At the same time, they had a huge number of tests to book, and also a large number of people to call back with test results. So we ended up in a perfect storm, much like other jurisdictions saw. Jersey saw exactly the same thing with their helpline numbers when they had a similar situation. So I'd like to thank everyone for bearing with us, but 111 is now returning basically to normal levels.
And of course, people can now book online if they want, so that should take a lot of pressure off potentially.
They can. 111 still does the booking end manually because, again, it can fluctuate according to supply, and they do still call people back or email back confirming bookings, but there is the opportunity, obviously, for people to now register for the vaccine when their age group is called online.
Talk about that, I think coming to my age group, the 60 to 65s are due to get their letter this week. Is that still on course?
Yes, it is. As far as I'm aware, those letters will shortly be going out. So you will shortly, Paul, be getting an invitation to come forward and get a jab in your arm.
Right. My son is disabled, has been booked in for his vaccine. My wife has had hers. My son has his booked for this week because they are carers. But because I am with Snaefell surgery, they refuse to give me my jab. I'm nearly 60. Tell me that I'm not a priority, as I am key to my son's care and I'm the only one that works. I contacted yourself and was told I'm not a priority.
Right, well, I'm not sure I turned around and said it wasn't a priority. I said what I said is decided by the GPs. If it's the individual, I think that's not something I, as Minister for Health and Social Care, can decide. I can't decide what order people get the vaccines. If someone is a carer for someone, they need to. That is a decision that has to be made by the GP. That means they are essential to that person's care, and they then have to come forward. They are then given an invite for vaccination. That's not something that can be made by anyone other than that person's GP. If the GP has not certified that that person is essential, then unfortunately they will be vaccinated as part of their age group, not as a carer. The one thing I would point out on the end of that we mentioned about work, the only one who works, if you are vaccinated, you can still catch COVID. And although it reduces transmission, you can actually still pass it on. So it wouldn't help with any work resilience, because if someone who's vaccinated contracts COVID, they still have to isolate exactly the same as anyone else. So it doesn't mean that if you're vaccinated, that's it. You will never have to isolate again. You can still contract COVID and you could potentially pass it to others. The main thing of the vaccine is it protects you, the person who's vaccinated.
This next one's fairly long. My daughter and two sons, one is in year 7 at MHK, were instructed to isolate from the 3rd of March. On the 5th, her son, year 7, was tested positive. My daughter and her eldest son were left for exactly a week, the 12th of March, for my daughter and eldest son to be tested, and they both came back positive. I find it disappointing that they were left so long to wait on the test. The probability was they were probably positive a lot sooner than the 12th, and they've been isolating together for 9 days at this stage. They were given results on the 12th, along with the exit dates all being on the 18th of March. She asked the caller to explain the situation that would happen after that exit date on the 18th. He said in all 3 of them, if they were negative, then all 3 were free to go on the 19th. If only one was negative, they could go on the 19th. And that was, and they were positively isolated for another week after that. There's a bit more to it, but I'm just trying to bring it down.
Yeah, it's a bit. But I'm trying to get that timeline.
Yeah, sorry.
So it's a bit hard to do. Right. So boiling to the end of it, which I think is the key point. If at the end, then all the exit tests are negative, then what 111 from that I think is saying is everyone's released. If someone is test positive, then they are isolated for another 7 days. That wouldn't have mattered at whichever point the test happens. If you prove positive on your exit test, then you are continued to isolate for another 7 days.
Okay.
So I'm not sure the first bit of it. Although, like I say, forgive me because
you're doing well actually with that.
But the exit point, which is the key point, that wouldn't necessarily be changed by having had a test earlier. In fact, if anything, if they were tested earlier, they're probably, they're testing positive on an exit test now, which was done later, then the likelihood is they would have been positive on that exit test anyway. So again, like I say, a bit of a long one to try and follow, but the key is the exit test. If someone is negative on the exit test after having previously tested positive, then they are released. Anyone who tests positive on the exit test would then have to isolate further for another 7 days.
Right. What is the waiting list for active operations? This gentleman went for a hip operation. He was really distraught that it's been put back and back and back, and he doesn't understand why that would happen, because it's not... he assumes that operations should still be going ahead.
It is physically impossible with the staffing at Nobles. We have got to focus on the COVID response. This was exactly the same as last year. Unfortunately, orthopaedics is one of those areas that has been most badly hit. We have been trying to look with the UK to see if we can partner up to get some support there to try and help reduce the lists when we bring things back online. But the problem is the UK is in exactly the same position. They have a huge backlog developing over there as well in relation to operations. So the support we'll be able to access will be minimal. We do, it's very distressing for a lot of people, particularly people who've been waiting a long time. But we do have to ask them to bear with us. At the moment, the focus has to be on our COVID response and ensuring that that is appropriately staffed. We have a finite, portion of staff, including bank staff. Many are self-isolated at the moment, the same as other people in our community. Many are isolating themselves or shielding, and we can only work with what we've got at the end of the day. And that's meant we had to take the decision to suspend elective surgery to ensure that we can provide a safe response elsewhere.
I'm guessing, though, in a normal year, it would be flu that would be taking up a lot of the beds and those sort of things, and you haven't got that particularly this year. Are we really out of kilter completely with a normal year?
Yes, completely and utterly out of kilter with a normal year. In terms of flu, while there is what we term the winter pressures, and we haven't seen as much flu, which again ties in with a lot of the rest of the world, where you've seen other respiratory diseases drop completely off because of coronaviruses. Because of COVID-19, we are still under serious pressure because the other issue is the isolation requirements that go with COVID-19 and the fact that you've got to have the full PPE and everything else and the risk of the transmissibility of the disease. So, COVID-19 should not be compared in any way to flu because it's not the same around transmissibility. It's not the same on how it does transfer, and it certainly is not the same in terms of the effect.
The next question, in fact, I'm going to lump two together, but it's taken up even more than that in the actual inbox today. But so part one is, why should there not be a public inquiry over the Isle of Man government and steam packet regarding the breakdown in communications and resignations? The public deserve to know the answer as the public is paying the price. And part two, please ask if the results of the independent investigation of the steam packet will be sent to the coroner of inquests, police, health and safety inspectorate, marine administration prior to being published. That will allow all matters to be considered by the appropriate statutory bodies first.
Right, so the Chief Minister has announced there is an independent inquiry going on. The Audit Division, which although part of Treasury is completely and statutorily in law independent, will be undertaking the investigation. That investigation report, as the Chief Minister's already pledged, will be made public. The Public Accounts Committee, I believe, of Tynwald has also picked this up. So from a parliamentary point of view, it's also going to be looked at. But as the Chief Minister has quite clearly said, if the investigation turns up anything that is seen as criminal, or there is a recommendation from the report that something criminal has occurred, then it will, of course, be passed to the police for investigation and also to the Attorney General's chambers for potentially any necessary prosecutions in that regard. I'm not sure why it would be passed to the coroner of inquests, because the coroner of inquests would only request something if it was related to a death. So unless the person is associating it with the one death we've had in relation to COVID, but that would be a matter for the coroner of inquests. The coroner of inquests, when they do the coroner of inquests into that person's death, that's not a matter for us in that regard. But as the Chief Minister has already said, the independent report will be published, so people will be able to see it. And in the event that any criminal wrongdoing is felt to have been found, then that would, as it ordinarily would in any other circumstance, be passed to the police for investigation.
But the Attorney General's department could be conflicted, couldn't it?
No, only if they were acting on behalf of the steam packet. Because don't forget, people getting confused again that the steam packet is not part of government. It is still a private company. The difference is the government is the shareholder. So it still operates as a private company. It still has its own board. They make the day-to-day operational decisions. So it is no different to any other private company. Government's role is a shareholder, exactly the same as if you or me own shares in a company. And that is the limitations on government's role as well. So government has the same limitations as if you and me were acting as a shareholder for a company, and equally the company itself operates exactly the same as any other private company.
What's going on? I'm seeing more and more construction workers back at work at the same places they stopped work a week ago. Have restrictions been lifted?
So those working outside, if they are working alone, or they are working in a pair but they can socially distance, then those constructions workers have been able to continue. What hasn't been able to continue is the mass site work. And as the Chief Minister announced again at the press conference on Friday, we were hoping maybe they could return next week. That's not now the case. So people certainly the major sites should not be up and running at this current time. It should be purely either one-man bands operating outside, or two persons if they are socially distanced, and also where a property is completely vacant. So that doesn't mean the owners have nipped out to the shop or something like that. Where a property is not occupied, indoor work can take place as long as the person is on their own working, or again, if it's two people but are socially distanced and not coming into contact with one another.
Can you advise if the Isle of Man government DTI trades are permitted to carry out work in schools that are non-urgent? I.e. painters are in classrooms. Trades are apparently continuing to carry out general refurbishment of non-urgent maintenance. My understanding was, as you've been saying, the construction industry is only permitted to carry out the emergency work and to be outside.
Now, to be clear, it's not just emergency work. If the property is vacant, so it is not in use, then basically a painter would be able to operate as long as they were working on their own, or as a maximum two people socially distanced. In those circumstances, it's not just limited to emergency work. They would be able to carry on and carry out the work. But if the property is occupied, then they cannot do so.
Why are restaurants allowed to open as takeaways, shops allowed to operate click and collect services, and civic amenity sites remain closed, which operate outside when social distancing can easily be achieved?
Well, there's a variety of reasons here. In terms of shops and click and collect, the risk is actually quite low. It's not without risk, and that has to be absolutely clear. Everything we do will carry some form of risk, but click and collect is low because the shop is preparing everything for you. The person is physically just simply picking it up, and there should be protocols in place with each of the stores to make sure that people aren't coming into contact with one another when the click and collect is being done. In terms of restaurants, I think it's very practical. We did this during the outbreak last year where they were allowed to operate takeaway services. It is important we try and support our businesses where we can. And this is something, again, that is very, very low risk because they are doing takeaway services. Again, there should be social distancing if people are able to collect from those services. And obviously, if someone's delivering from those services, they're even more low risk. In terms of the civic amenity sites, the difference with that is that you would claim that, you could say it was, you're delivering potentially large bulky items off to the civic amenity site. All those items then have to be processed after they've been dropped off. So they're coming out of someone's home into the civic amenity site, and then the staff at the civic amenity site are having to process those items out the other end. So that carries much more high risk, because you're putting something into an environment that then requires processing rather than simply picking something up.
Okay, 2 to go. The current vaccine is only tested for age 16 plus. What is being worked on to produce protection that is relevant for our children?
Trials are already continuing. So the moment the vaccines aren't recommended for those under the age of 16. AstraZeneca is actually only 18 plus, but Pfizer can be delivered for the 16 to 18 age group. The only reason it's not recommended is children of that age were not included, as the person with the question has rightly pointed out, in the initial trials. It was only done on adults, Pfizer 16 plus, AstraZeneca 18 plus. That doesn't mean that they're saying the vaccines aren't suitable for children longer term, and there's currently trials going on in that regard, which I believe are due to report within the next month or so, around the safety of the vaccines and children. I don't tend to like to be a betting man, Paul, but I would suspect that those trials will conclude that the vaccines are perfectly safe to use on children under the age of 16 in the case of Pfizer, and under the age of 18 for those in AstraZeneca. But we need to wait for those trials to be confirmed, and then the marketing authorities to change their marketing authorisation to allow them for use in children. As I say, we expect those trials to conclude in the next month. And, you know, I wait to be proven wrong, but I get the feeling the trials will probably result in saying that the vaccines will be able to be used on children.
To finish with, and this one has taken up a lot of space, and I'm sure you've had the same thing, hearing on social media particularly that a lot of younger people in the 50 and unders are already getting their vaccinations when they seem to have no underlying health issues. What's going on? And I do know somebody about 35 who he says has nothing, and he's had an invitation and had it. Now maybe he knows something on his record, I suppose, when he was a child or something, but what's going on?
But the only people who can make the decision whether someone is vulnerable or not is the person's GP. It's a manual process for the GPs. They have to go through the patient records, looking at people's full medical history, because only the GP has access to someone's full primary care medical history. And off the back of that, they have actually decided who is vulnerable, who is not. And then they've been invited. Now, I've been contacted by quite a few people who don't think they should have had a letter. So we have looked into those, and I can only speak about the cases I know about, but certainly of the ones that have been investigated by my office, on further investigation, every single one of them has been invited correctly. Now, in some cases, it was the case either someone didn't class something that they had wrong with them as a condition, so they didn't see it as a condition, but it does make them vulnerable, or in other cases, it's a condition someone's got over, so they think, well, actually, that was quite a few years ago, so I'm no longer vulnerable. But actually, it does still make them vulnerable, and that's why they've been invited. Now, it is now that's not saying there haven't probably been any errors. It's a manual process of GPs going basically through, effectively on our population, 85,000 patient records. Now, in that, I would not be surprised if there have been errors, but certainly from what I can see, there would be very few handful of them, but certainly the ones I've had looked at where the person has turned around and said, well, I'm not sure I do qualify. On further investigation with their GP, the GP has been adamant they do qualify and they are within the vulnerable category.
Okay, that's some of them. Apologies I didn't get to everyone's question today. We actually got more than anticipated at one stage here, but a lot of them were on the same subjects. But whatever the Chief Minister says, people do like questions, and I'm glad you're here to answer them, Mr. Ashford.
I'm always happy to put myself up, Paul. You know that. I might not always have the answers, but I'll certainly try my best anyway. Okay,
we'll be here. If you've got a question, news@manx.net is probably the easiest way. Drop me an email, and we'll be doing the same thing next week.